favorite new topic. This has really been something that's just really become to the forefront now. I'm sure everyone's hearing about it on social media. Everyone's talking about it. When it first came out, and when peptides first started introducing themselves, we would talk to patients and their eyes would go back and it sounded like the craziest thing on the planet. You're going to give yourself these shots and they're going to do this and that, and no one really thought about doing it or wanted to do it. It's almost as much as when we started an IV clinic and people will say, well, I'm going to come get an IV for it. That's crazy. And now everywhere around the world, everyone's doing IV therapy for people. So peptides are really amazing substances. Just to lay the foundation, everyone knows about what peptides are. The most common peptide we all know about is insulin. And so that's one in our body that's working, signaling blood sugar and stuff, metabolism. But these are going to be some specific peptides that have been developed. And as just over the past several years, more and more developed, and they have very targeted selective use. Basically what peptides are is a group of amino acids that are hooked together, and they form a little chain, and basically they stimulate receptors. So there's receptors in your body that when they touch them, it's like plugging something into an outlet. When you plug those receptors with the peptide, it stimulates something. It causes an action, no matter what it might be. I'm going to talk about all those different kind of peptides, and so basically the targeted signaling, they act like biological messengers. And they do mimic the natural body, so that's kind of why they work so well. They're not generally metabolized by the gut, because most of them are injection. So I'm going to talk about some of the more specific ones. So the ones that most, well, I'll go to that actually. I love to use for metabolizing, healing, hormone signaling, brain and nervous system, things like that. So really I'm going to jump right to the GLP-1s if you want to put those up. Okay. So those are the most common ones that people know. I guess I should do that disclaimer. Peptides are not FDA approved, except only one peptide is FDA approved, and that's tesamorelin, and it's really approved for not anything that we use it for people with, but all of them are off-label use, and so people go, well, that's scary, it's not FDA approved. Well, you could never get anything FDA approved for what we do. It's more of a functional type of a thing, so FDA doesn't go for this. Now, maybe with some of the newer changes in the FDA, they may do it, but they didn't. So it's off-label use. Many things that we use in life are off-label use. We'll use a medicine for something that was developed for something else. And so that's really what these are. So the first peptides I'm going to talk about, and these are the ones that most people are familiar with, the GLP ones. These are really started out, the GLPs, they're for weight loss, but that's not really what they first were invented for. The GLP peptides were first developed for blood sugar control. So they were used in diabetics, people who they could have been people that were on insulin, but mostly it's adult diabetics. People who cannot control their blood sugars with diet, and then they may have put on some medications, and then still having trouble with their blood sugars. So the GLPs actually help your body regulate insulin and regulate blood sugar control. As the people were on them, now the use changed. It became more of an off-label use. We saw that people who used them had tremendous weight loss, which worked really well because most of the people who had the need for it had elevated blood sugars. They were overweight. So once they started having their weight controlled, guess what? Their blood sugars came down. So who really knows which came first, the chicken or the egg, whether they lost the weight and their blood sugar got or that actually helped it. So people started using it for weight loss for people. And it is profound. I think everyone knows someone or everyone has at least tried one of them now at this point. And they work profoundly for weight loss. The first one out was semaglutide, and that was Ozempic, and it works very well. Most of these peptides are once-a-week shots, so you get them once a week, and it really profoundly suppresses your appetite. It works at the gut level to suppress your appetite. It stimulates a hormone that's released that goes to your brain and tells you that you're full. So it gives this feeling of satiety. So semaglutide was the first one. There's tirzepatide, which is the next one, and then there's some other ones that are out there in development that are not quite out yet. So if you look at those, semaglutide was the first one. It has the most side effects, really. That's the one that came out a lot of times with semaglutide. It causes a lot of nausea. And so that was the big downfall with it. Or really, in a small extent, if you were a little bit nauseous, you would not want to eat as much. So it did help with the eating. But no one really liked being sick. Tirzepatide really basically causes no nausea at all. So that's one of the benefits of that. So people can take this really for as long as they want, as far as they want to continue to lose weight. So depending on how much weight you want to lose, you can do that. Now, one of the things that's happened, again, now another offshoot of these GLPs is another use for them. What they found is they are profound for inflammation. So people who have inflammatory markers in their blood, like elevated reactive proteins or autoimmune problems, they lower those markers. They lower the inflammation. And it's pretty traumatic for people. So people notice that symptomatically. So now people are starting to use them in lower doses to treat inflammation. So that's kind of a neat thing, because things that people couldn't get by with, they're taking Motrin or Aleve or prednisone, now they have something else that works a little bit more naturally. The other thing that one of them does, tirzepatide has another unusual benefit, is it helps with obsessive behavior. So people who are obsessive nail biters, pickers, or maybe even have OCD, tirzepatide helps with that. And I've had several patients come in and want to be put on it for that, and it's been pretty dramatic. And I can even talk about my daughter's use of it. She was a nail biter and would bite them off completely. And she went on very low dose tirzepatide and got two big benefits. One, she stopped biting her nails, and that was impressive because we tear them up. Secondly, she had thyroid antibodies, which is an inflammatory marker. It's also called Hashimoto's thyroiditis. Her markers were in the thousands. And after she was on tirzepatide for a bit, it's down to 20. So just profound how much it changed that with just doing this. She's not on a weight loss level dose. It's a much lower dose for inflammation. So there's a lot of benefits from that, and I think as we go along, we'll see more benefits. The main thing with these peptides is they are all injectable. And that's what is the biggest drawback for a lot of people, is that for this one, it's a once-a-week shot. Some people just don't like shots. They come out with some oral versions, pill forms of them, and they work. They just don't work as well. So people, I'd rather take the pill. Well, the pills are expensive, and they don't work that well. So you're going to have to deal with that portion of it. So I'm going to go on to the next one. So that's how it works. It slows your gastric motility. The insulin definitely helps with the blood sugar, and it reduces cravings. And so what it is, it makes things that you wanted to eat all the time go away. And almost to the point where some things are really beneficial. One of the things that was a noted maybe benefit, maybe not, is it suppresses some of the alcohol. People who drank a lot feel like they lose their taste for alcohol, particularly beer. So people just sort of stop drinking as much. And so that's a nice benefit if someone was having excessive amounts. And so people just go there, have a drink, and they go, it just doesn't taste the same anymore. So that's a nice perk of that. That's what that stuff is called, food noise, when you're thinking about food all the time. So it definitely helps with the weight loss. Really, the way it works for weight loss is purely just suppression of appetite. It doesn't really increase your metabolism, so it doesn't do anything that way. And that weight loss then certainly helps affect your blood sugar, helps affect insulin levels, and that kind of stuff improves. And that's really what we want. The hemoglobin A1C, which is kind of a marker for elevated blood sugars, go down. Metabolic syndrome is a problem where people are overweight, they have high blood pressure, high cholesterol, and diabetes. It actually helps that because, again, it's changing that spiral back out again. Once people start losing weight and feeling better, they become more active, and that changes that whole trajectory. More activity causes more of that, because most people, let's face it, when you're sitting, what do? You start snacking. So the more we can keep people moving, all of those things go in the right direction. So there are some really new peptides that are out there that have a lot of interest, and these are the ones that stimulate growth hormone. So these are more, they call them longevity. They not really work for increasing your lifespan, but they're more anti-aging. And these were ones that they stimulate your brain, they stimulate your pituitary to release growth hormone. And growth hormone is the miracle drug for aging. So when we used to see actors who were never aging, and all of these people that no one had access to this stuff, they were taking growth hormone. So growth hormone in our body after our 30s starts to go down. And that's what really helps with tissue repair, joint repair, clarity, metabolism, things like that. And so there was no real way of taking it. And people thought for many years that our brain stopped producing, there was not being produced in our pituitary gland. So they started giving people growth hormone, small doses of growth hormone. And that was called anti-aging doses or whatever it is, and it helped people's skin. You see all these people, they look much better, they have better cognitive function, and they start to lean down because it causes a muscular activity of burning calories and definitely leans you down. Well, the problem is they realized, or not really a problem, a benefit is they actually learned that there was a good amount of growth hormone in your pituitary. It just needed to be stimulated, and that's where these come in place. So CJC 1295, ipamorelin, tesamorelin, those are all those growth hormone agonists. So CJC, ipamorelin, those are sometimes combined together. The ipamorelin tends to work a little bit quicker. The CJC works. Now these are administered in a different fashion. They are in shots, but they're generally done about 5 out of 7 days a week. So they're small shots that people do daily. You don't really feel much from them, although sometimes with the ipamorelin you get a little flushing, so you just feel a little warm for a second, but that's about it. They're not stimulating, so you don't feel a big surge of energy, you don't feel tired, any of those things. Testosterone is probably the most powerful one as far as stimulating growth hormone. So what people notice with that the most is they just start naturally leaning down. They start having much more benefits of whether they work out or not. If they're dieting and stuff, they just start seeing the muscle lean, they get more pronounced, much more mental clarity, and much improvement in your skin. Your skin just looks a lot better. So these are the people who start to look timeless. Why are they not aging? It's that kind of stuff. Those are the advantages of it. The main disadvantages of them, they take a little time to work. So CJC, and they take 3 to 4 weeks before they start kicking in. So these are meant to be used for several months, if not longer. So they're not a one and done kind of thing. Testosterone starts to work in probably a couple of weeks, but it's the same thing. It's meant to be used probably for several months or longer.
Can you stack any one of those peptides?
You can, yes. And people do that all the time. You probably wouldn't want to stack the growth hormone ones. You probably wouldn't want to take the CJC and the testosterone, that. But you could definitely take those growth hormones with the GLPs for sure. People do that all the time because you're going to just do mix and match for sure. Anyone has questions while I'm talking, please just go ahead. So really what it does is it stimulates the growth hormone. The indirect way that we measure that growth hormone level is a substance called IGF-1, insulin growth factor 1. So as we start aging, that number goes down. It's the highest in our teens and 20s when, of course, we're all just feeling full of life and amazing, and then it starts to go down. So that's one of the things that we look at, and we see that level go down. And as we start adding these to you, they start to come back up again, and that's when people start to notice them. So that's our monitor of that. So testosterone is very good for visceral fat, which is, most guys know, that's the most impossible fat to lose, right here. So you can lean down here, it's kind of the skinny fat, then you have skinny arms, skinny legs, but you have a gut. And that's the fat that's not right under the skin, it's in your omentum. And so what happens is testosterone really helps with leaning down of that. So that's what causes people to have a flat stomach. Women too, not just men. I'm not looking at you, you don't have it.
When you stand up, the demonstrator.
So now we're going to go to some peptides that are healing. So you go to ones that are controlling appetite, ones that are stimulating growth hormone, and now there's healing peptides. And these two are really pretty impressive. BPC 157 and TB 500. So both of those work by injections around the area of injury, whether you have a ligament injury, a tendon injury, a muscle injury, or whatever else you have, even a fracture. People will take the peptide, and it's really weird how it works, in that way that you inject it around the area. And you'll inject it usually twice a day for 1 month. And it really stimulates basically all of the healing and growth factors that normally work in your body to heal a cut or whatever that's there, to really aggregate in that area and really help heal that tissue. And people who have used them really sing their praises because it worked very well. TB 500 is used a little bit differently. It's a single shot that is used anywhere, and it goes throughout your whole body. So TB 500 stands for thymosin beta. That's our whole thymus gland, and that produces that. And that's where that came from. Many times people mix the two together because they get an added benefit of healing. The TB 500 is going to work all over your whole body, where the BPC is going to be a little more targeted. So when you mix the two, you get both selective and as well as overall healing of different things. Because a lot of times people need it in multiple places. One of the benefits of BPC, which is nice, is actually has an oral form of it, and it really helps repair gut. So people who have leaky gut, lots of irritable bowel, maybe even Crohn's, things like that, it actually works for them. That pill is usually people take it for 1 month, and that kind of resets it. I've tried every peptide, so I know it's going to work. And the BPC oral definitely works.
The BPC oral, you said that one's for leaky gut, or both of them are?
The oral BPC is, because that one works right in that area.
And you'd only use that for a month?
That's typically what people do. They use it for a month and they stop and reassess, because it's really going to initiate a lot of healing in that area.
Can you use the oral BPC other than for gut or leaky gut?
I think you could, but I'm not sure if you're going to get the same response.
Okay.
And that's sort of the problem, because if you're going to take it, why not try and get everything you can out of it? I know it's the benefit of taking a pill over a shot. Every day, everyone's going to want to do that. But you're going to inject it around your knee.
Okay.
So if it's your elbow, you're going to put it right around there. They have a blend of the TB 500 and the BPC 157 called Wolverine blend. I don't know where they came with that name, but basically it's the two together, and that's a single shot once a day. And that's usually for a month. So this is how they work. They stimulate all of those chemicals in your body that heal stuff, and they brings all of them there, blows a whistle, said, hey, let's get into this area and heal it. So it increases those levels around that area. So that's how everything is repaired, things like that. It works very well. I can tell you, we've had a lot of experience with people using it for elbow pain and shoulder pain. And it's been pretty profound, where people they may have had surgery, or they got a candidate for surgery, and they have ligament and tendon tears, and they use it, and they've got complete repair of that. Has anyone here tried PPC 157? Have you had good success with it?
Yeah, I've taken it a long time because I've got a lot of injury.
So these are some of the ones, these are two that I really like. These help metabolism. So the GLPs control appetite. These stimulate metabolism, so they actually increase calorie burning. So that's a big thing that we have, is we're all dieting. What happens is our body starts to slow down the calorie burning to save them. So MOTS-c is a mitochondrial stimulating peptide. It works at the cellular level, particularly muscles, and it stimulates activity, which then translates to increased calorie burn. So one of the big things that it does is it leans people down. So people who have been dieting, but yet they feel like, I can't get rid of the subcutaneous fat, again with the visceral fat, it's one of those that does that. And it's it's the same like all the other peptides. It's a 5-day-a-week shot, and people usually do it for 1 to 3 months, and people dramatically, always predictably notice this cutting and getting rid of fat with it. It's very impressive. AOD, that's going to be another one that works for that as well. MOTS-c, and they do not come in an oral form, unfortunately. But I can tell you from personal experience that MOTS-c works amazing. Really, after 1 month, you really start seeing definition. You start seeing, you can see your six-pack and things like that. I've said it all, but yeah, reduce visceral fat. These are two new ones, and these are ones that work on your brain. Selank and C-Max, and these ones have just recently been released. Selank is a neuropeptide. They're both called neuropeptides because they work primarily in your brain. Selank really helps with anxiety. It really does, and it helps increase 5-HTP, dopamine levels in your brain, but it really is a calming peptide. So people can use it every day if they want, or they can just take it as they need it. So for people who are plagued with anxiety, maybe can't take medicines for drug screens or things like that, or worried about impaired mental function, but they take things like Xanax, Selank is a very good. It definitely works for sure. So it's one that if you didn't want to take every day, you could take it as you need. I'm having a bad day, I'm going to take a shot of that, and it kicks in and starts to work. It's relaxing. It is not sedating. It's not like anything that we've really experienced before. C-Max is a newer one. That's another one. It's called a nootropic, and that's one that improves mental clarity. And that's the big thing that really is the big push for with everything. One, increase energy and increase mental clarity. So increase cognitive function. So what that does is helps people stay on task. It helps more mental clarity, so it helps sort of, it's an injectable form, they try to promote it as an injectable form of Adderall. It's going to give you that much focus. I haven't experienced that myself. I'm on that. I have seen the more energy and more clarity. I wouldn't say it's that profound for that, but maybe I haven't gotten the right dose. But other people have. They use that when, again, they don't want to take medication for stuff. They might just need a little bit more help with work and office tasks and staying on point. That's one of those that's used for that C-Max.
Is that a daily or weekly?
That one is daily. The Selank is daily or however you need it. There you go, modulate thing, reduce anxiety. I'm one behind on my slides. I'm going to run ahead, I guess. So how do you decide what kind of peptides you want to use? Because there's a lot of them. And someone asked about can you stack them? Many people do. What we want to try and do is really, I look at them as more icing on the cake. When people come in and they have some problem, I want to fix the underlying problem if it can be fixed. They work well at anyone who's coming in, but if someone comes in and they need to lose weight, their energy's poor, we certainly want to make sure that their metabolism is good, thyroid's functioning properly, the testosterone, all those things are optimized, and then after that, you add this on. That's when you're going to see the best results. Because if they have to do all of the work of having a low thyroid, if you're not really doing your diet and things like that, it's not going to be able to push it that far. So when you're doing things and you say you want that little nudge, that's where these really come in. And they are very powerful to that point. So again, it's going to be based on what we're thinking, trying to treat. So if someone is really trying to lose some weight, that's definitely going to be one of the GLPs for sure. That would stack well with one of the things that burn calories if you wanted to do it that way. People that want to do the anti-aging. There's other ones that stimulate growth hormone, but they're also going to have the added benefit that they're going to lean you down at the same time. They're going to increase cognitive function, so people notice much more clarity, improve quality of sleep for sure with all of those. So we want to look at stuff to see what kind of medical problems they have. Honestly, they're very safe, even though we do that history and we look at labs. Probably the labs are going to be most important for the GLPs to see if they have elevated blood sugar and A1C, but they are not stimulating, so it does not increase anyone's heart rate. It doesn't do anything like that. It doesn't lower your blood pressure or increase your blood pressure. They're very safe. There's another peptide. I'm not sure if it's on there, the copper peptide. Maybe not. I don't want to go to it because I don't think I put it on there. So it should be one. There's a copper peptide, and that one is really helps with skin integrity. So when we look at anti-aging, we start getting the laxity in our skin and the signs of aging and all the stuff that we don't like. The copper peptide is one that helps with that. So it helps improve the integrity of our skin, really has a lot of the anti-aging stuff as well. And so that's one that's full circle for all of the different things that we're trying to do. And it is actually copper, it's a little bit blue, and so it works well for that. So there are some things that people can't use it for. One, particularly the active cancer, that one's going to be primarily the growth hormone stimulant. So anybody that has cancer that's ongoing, you don't want to give them any kind of growth hormone because it's going to stimulate the cancer to grow more. And that's not really been 100% proven. It's more anecdotal. People just think it's going to do it. So no one has really actually had it because there are patients who take it. So it's more of a worry thing. Well, we just be precautious with that. Or someone had a history of cancer, you try to avoid it. So it is confusing, and really even as a practitioner, because people who may have had something 20 years ago, when do you say you're completely healed from it, can they take it or not? And I think it's going to be a personal discussion on that. Certainly pregnancy, we're not going to do any of that, or breastfeeding, because it doesn't, we don't want anything to translate. Well, the memory ones, those sure are not going to, that's not going to fix all of this psychiatric thing. And poor follow-up. Well, certainly we want to make sure that you're using it right and getting the best results of it. Because what we see over and over again is people take it and a week later forget how to use it. And so they'll come in and go, it's not working. So how are you injecting it? I don't know. And they forget. And that's the thing. So it really, in the beginning, we like to have really close follow-up with people to explain how they're doing and make sure they're continuing to do it right. Because a lot of times when we're talking, we see this all the time, when we're talking in the office, people, they understand it, but we realize that most of that goes out because they're just too busy trying to think about the first thing I said, and the rest of it's not there. Even though we give instructions and we write it all down, still, it's like, oh, it's in your paper. Oh, I forgot that I didn't have a paper. So it's there. So that's the main thing. We want to make sure that people are getting the optimal results and they're doing it right. Well, people who should do it have unrealistic expectations. Well, that's true of everything in life, pretty much. People who are going to come in and not want to diet or do anything and expect these things to transform them completely, it's probably not going to happen. It really is, I think, the best people that get the best results from it are people who are motivated and trying to do everything they can, but really want to accelerate it along. And that's what people notice the best benefits from. Well, the gradual improvement, that is true more for the growth hormone peptides for sure, and the skin ones. The weight loss ones, the GLPs, people notice that immediately. So when they get one of those shots, the tirzepatide, semaglutide, their appetite is suppressed the next day. So those are pretty quick. Now, of course, just because you have a suppressed appetite doesn't mean you're losing weight right away. So it's a good start. And when you don't feel like eating, then you start noticing it. And so it really builds one of those ones that builds up momentum, because once you start having some positive results, then it motivates you not to eat so much and become more active, and it just starts. And people lose profound amount of weight with this. It's really amazing. I think probably it's been the death of gastric bypass surgery for sure, because we have multiple patients that lost over 100 pounds using this thing, and not in a long period of time. So it just melts off as you continue to take it. So that's, like I said, not substitute for lifestyle. That's what it is. They're very targeted biologic medicine and trying to find the right peptide. Because what I see a lot when people come in is they see a peptide, they go, I want to take this one, and instead of me just filling it and saying, here you go, take it, I want to find out what they want it for. What are they trying to accomplish? Because sometimes people just see the couple of the things that get improved from one peptide, but it might not be the best fit for them. So again, if they're getting the one that doesn't really work right, then they're not going to have good results, and then they're going to say, oh, these peptides, they don't work, it's a bunch of crap. When they can work, we will make sure that it fits.
As far as for the injections, where's the best place? Stomach. Yep.
It doesn't matter, and that's one of the things, that's one of the fallacies that people definitely have with insulin, all of these things, even the appetite ones. People think, well, it's going to suppress my appetite, I got to inject it in my stomach. It doesn't matter. It goes all over your body. If you put it in your big toe, it's still going to work. So you try to find a place that hurts the least, really. Sometimes that is the least place, but you can do it in your arm, your thigh. It literally doesn't matter. You don't have to do it in the same spot over at the same time every day. You can do it wherever. It works very well.
Are they subcutaneous or?
Yes. They can be IM. It's still going to work. Most people are using insulin needles, so they are more of a subcutaneous thing. The only one that has to be a little bit more specific, I misspoke, is the DPC. That one definitely has to be injected in a targeted area. That's the one where it works for the injury.
And then, so if they're all subcutaneous,
It makes it a lot easier, much less painful. People don't even feel it, really.
if it's sub-Q versus IM, does one stay with you longer, or does the fat?
Well, they both get absorbed. For certainly, we see that even with testosterone therapy, people who do subcutaneous versus IM injections, they both work, the levels go the same. It just corrects how quickly. The IM ones are picked up very quickly, and so the blood level is much more profound, quicker. The sub-Q gets that same level, but it's a more slow rise. But it's going to work. It's not going to work.
Oh, okay.
Now, I think if someone was very big, we're talking super big, that might be an issue. But it doesn't matter where you inject it anyway, you're going to be sub-Q in that person anyway.
Well, taking the peptides, does it have any effect on your kidney functions or liver functions or anything like that?
No. The only way it would have that, and, well, I'll take it back. It can if you, particularly the appetite suppressant ones, if you get behind on your fluid. And that's a big thing, because people are taking them, and they're getting pretty profound suppression of their appetite, but then they may not drink as much. So all of a sudden they get a little bit dehydrated. Generally, it's not going to cause kidney problems, but you will see that on their labs that they're a little bit dehydrated, because they just don't feel it. They just don't feel the need to it. So that's one. They don't really impact your liver enzymes or anything like that. Some of the growth hormone stimulating peptides, they release growth hormone physiologically. So if you take just growth hormone by itself, which is what a lot of people were doing, that can increase your blood sugar at high doses. The ones that you take, these kind of peptides, they release it physiologically. What does that mean? Well, when we're young and we have plenty of growth hormone, it's released through little squirts throughout the day, and that's how it causes it to be released. It generally does not increase your blood sugar, doesn't increase any of those markers at all. In fact, most of all of the peptides decrease inflammatory markers in your body, which is good. They improve lipids, things like that. So you just see a general improvement in your metabolic situation.
And peptides or whatever, I know that you said they were like amino acids or whatever. Where are these amino acids derived from? Are they plant-based, animal-based? How do they develop these amino acids that we're...
I really don't know that. Amino acids are the most basic building block, so I don't know where they get them from, honestly.
Doctor, are these peptides pre-mixed, or do we have to use sterile water?
We usually mix them for everyone, unless someone wants to reconstitute it themselves, because that's another issue. If I give you the bottle and mix it, how do I mix it? How do I do it?
Right.
So we want to try to make it as easy as possible. We pre-mix it, we give you the syringe to show you exactly where to draw it up to, and where to administer. So we don't want to, here you go, here's your peptides, figure it out. Which is what happens when you order them online. There's a lot of places online that are selling them, and people just come in here and they go, I got this peptide, how do I take it? And a lot of times it doesn't even have what is in it or the milligram amount. I'm like, well, I have no idea because I don't even know what it is. And so you're buying it overseas, who knows what it is? But there could be some reputable ones, but you're going to get it, you're going to figure it out on your own that way.
Because it's hard to get the sterile water as well, unless you have a prescription or...
Well, I've heard people just mixing it with tap water, and so that's probably not the best way of doing it, but people do a lot of things. So.
From a pharmaceutical, the same as everything else you get?
Yes, they all come from compounding pharmacies, so they're all tested and regulated that way.
So they're pharmaceutical grade.
Yes, absolutely.
peptides.
Oh, everything comes from licensed pharmacies and such. We don't buy them from India Mart or anything like that. And there are a lot of those available.
Right.
And maybe some are good, but we don't want to take any of that. We're going to be held accountable by giving it to you. We want to be able to have someone go, listen, we have this product, what's going on? Why isn't this and that? So we want it to be standardized. That's another thing that you see when you order them, is they'll put different milligram amounts in bottles. So they'll say, oh, this tirzepatide is $50 for a vial when it might normally be much more. And then you look at how much is in there. Well, you might need whatever X number of milligrams, and they're putting a small amount. So yes, it's cheap, but you need 30 of those bottles. So that's the kind of thing too. It's the old usual thing of humans, whatever they are, it's always trying to trick other people, unfortunately. So
I want to ask, when you take it for a month or every so often, you have labs drawn and rechecked and different ones, even if they're not the weight loss ones for the insulin. And you just go how you feel.
So it depends which ones we're doing. The DPC one for sure, we're not going to do any labs. Most people come in, they're examined, we already know where their injuries, and we're really going to see how they did with it, you know, as far as that. So if you really wanted to do your own little scientific experiment, you could draw that IGF factor and do it again. Most people are not too fond of getting any more needle sticks. They already know it's low because of how they feel and how they look.
And which one is your favorite?
Westmoreland is probably the best one of that. But CKC is a good one too. They're all good. That's just better, best kind of thing. Yeah.
Which one would you say is the best for inflammation, chronic inflammation?
Well, so that becomes really a mixed one. That could be one of the healing peptides. That could be like the CD500.
Is that the Wolverine one?
Yes, that could be that one. But also almost some of the off-label use of the GLPs, the tirzepatide and things like that. So at a lower dose than what might bring on weight loss, you get rid of the inflammation. So I think that's a whole other thing that's evolving. That's been a whole new push for stuff that people come in for. They've been on all kinds of stuff and their joints just hurt and all of that hurts, and it's you're sick of taking how many Motrin can you take a day and worry about that. So that's a nice benefit.
What's the price range between some of the different...
I have a question. I just got from you
it is, yeah.